Nephrotic syndrome. Nephrotic syndrome is a group of disorders, disease, characterized by massive proteinuria, more than 3.5 grams per day, hypoalbuminemia, edema, lipiduria, which is lipid cast, hyperlipidemia, hypercoagulability. Proteinuria is the most significant of these, and it leads to hypoalbuminemia, which is the cause of edema. Note in case of nephritic syndrome, edema is due to sodium and water retention. The proteins decreased in the nephrotic syndrome due to proteinuria include albumin, which is the most common, causing edema, transferrin, which is causing macrocytic hyperchromic anemia, cholecalciferol binding protein, which is CCBP, cholecalciferol binding protein, causing hypocalcemia. TBG, thyroxine binding globulin, causing decreased thyroxine level. Ceruloplasmin, fibrinogen level is increased due to increased hepatic synthesis of fibrinogen. Because albumin is synthesized பண்ணல அதனால fibrinogen. So the things which are reduced include albumin, transferrin, cholecalciferol binding protein, thyroid binding globulin, and ceruloplasmin. Okay. So there is increased chances of getting infection. Spontaneous bacterial peritonitis is the most common infection. Most common cause is Streptococcus pneumoniae, which is pneumococci, followed by E. coli, which is the second most common cause. Primary nephrotic syndrome, most of the children, 90% of the children with nephrotic syndrome have a form of idiopathic or primary nephrotic syndrome. Causes of idiopathic or primary nephrotic syndrome include MCD, which is minimal change disease, MPGN, which is mesangial proliferative glomerulonephritis, FSGS, focal-segmental glomerulosclerosis. Thus, minimal change disease is the most common cause of nephrotic syndrome in children. MCD, minimal change disease, it is also called lipoid nephrosis. So we'll see like question answer Mari. So what is the MCC? MCD is the MCC, that is most common cause of nephrotic syndrome in children. What are the two features of it? Edema and selective proteinuria are features of nephrotic syndrome. Fever may be present on account of increased susceptibility to infection, but by and large only two features are there. One edema, இன்னொன்று selective proteinuria. What is the selected protein here? Albumin. Okay, what is the fever due to? Increased susceptibility to infection. Onset and age. So like the MCD presents with insidious onset of nephrotic syndrome. Age on the children less than 6 years old. Okay. Two rare features. Okay. 2H are two rare features. Hypertension is not a feature of nephrotic syndrome and is rare in MCD because MCD is a nephrotic syndrome prototype. Hematuria, a feature of nephritic syndrome, is also rare. So the two H's are rare in case of MCD. Hypertension, hematuria are rare. Okay, let's see the pathology under various settings. The first one is light microscopy. Light microscopy, it's a minimal change disease. So, நம்ம லைட்டா அப்படியே microscope பார்த்தாக்கா nothing will be seen. So, no abnormality. Second is electron microscopy. Obliteration, that is loss and fusion of the food processes of epithelial cells will be seen. Obliteration or loss of food processes of epithelial cells. Immunofluorescence, no deposit of immune reactants. Serum complement normal level. Okay, and then cast urine shows lipid cast, hyaline cast, no RBC or WBC. Hell of a cast are seen. Hell is HELL. We see H is hyaline, L is lipid. Okay, so pathological features: light microscopy none, immunofluorescence none, serum complement normal. Abnormality is seen only in electron microscopy. உத்து பார்க்கும்போது தான் தெரியும். What happens is obliteration. It's called effacement of podocytes. Yeah, it's called obliteration or loss and fusion of food processes of epithelial cells. And then cast will be seen, lipid cast and hyaline cast, no RBC, no WBC. Minimal change disease has a very good prognosis with excellent response to steroids. So steroid கொடுத்த உடனே the person starts running. Okay, I'm just kidding. There's no running and all. It's just the person gets better. That's what I meant. And then in case of development of adverse effects of corticosteroids or in case of corticosteroid resistant nephrotic syndrome like FSGS, we use cyclosporin, cyclophosphamide. Okay. So that's about MCD. So we saw like the features of nephrotic syndrome, which is like proteinuria, massive proteinuria, hypoalbuminemia, edema, lipiduria, hyperlipidemia, hypercoagulability.